2 p.m. I'd like to ask Representative Marshall to please give the invocation.
Creator God, we just come to you at this time and we just ask for your wisdom and your guidance as we move through this meeting. And we just ask that you continue to bless all the staff and to bless all the employees of Creek Nation. And we just ask that you continue to lead and guide this nation as we move forward. And we just ask that you just provide blessings in everything that we do, and that you ordain all the things that we do today, and that we do it with grace, and we do it with love and respect. And we ask all these things in your name. Amen.
Roll call, April Lindsay.
Mary Crawford,
Present.
Joyce Derrick,
Present.
James Jennings,
Here.
Anna Marshall,
Present.
Lucian Tiger.
Present.
And we have 5 present, 0 absent.
5 present, 0 absent, constitutes a quorum. All business conducted will be official. Next item on the agenda will be approval of minutes, January 7th, 2020, and January 15th, 2020.
So moved.
Representative Marshall made a motion to approve the minutes with any changes necessary.
Second.
Second by Representative Deere. Discussion. Any discussion? Roll call vote, please.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Derrick,
Yes.
James Jennings.
Yes.
And we have 4 0 absent.
4 in favor, 0 against. That motion passed. Next item on the agenda will be order of business. Rural Fire Department applications. First one will be Mill Bay Fire Department. It was postponed on 1/15/20.
I confirmed with them last week that they will be here. I haven't got word today, but I did confirm with them last week.
Motion to postpone indefinitely.
Representative Jennings made a motion to postpone Mill Bay Fire Department indefinitely.
Second.
Seconded by Representative Deere. Discussion. Hearing none, roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Derrick.
Yes.
Then we have 1 in favor, 0 against.
4 in favor, 0 against. Mill Bay Fire Department is postponed indefinitely. Next on the agenda would be Rolling Hills Fire Department. It was postponed on 1/15/20. Representative Jennings.
Make a motion to postpone indefinitely, but I'd like to have the AD's office.
Representative Jennings has made a motion to postpone indefinitely.
Second.
Second by Representative Deere. Discussion. Mr. Jennings.
Ms. Copal?
Yes. The Office of the Attorney General was requested a little bit of background information, what constitutes rural fire departments as far as this grant goes. Our office pulled up the last legislation when this was passed, NCA 15-119. And in this, it states that rural fire departments shall mean recognized firefighting organizations that exist to assist rural areas in the firefighting and fire prevention. But what we really wanted to look at was the eligibility, what makes these fire departments eligible. And it lists requirements that must be met in order for these fire departments to get the funding. And in this specific case, I think the biggest issue we have besides what constitutes rural is subsection E, in which it states, upon receiving a rural volunteer fire department grant, the grant recipient must agree to waive the annual fees for all Muskogee Creek citizens that reside within the rural fire department district. So usually in these rural fire departments, they're self-sufficient. They're either getting their funding from fundraisers, or they charge individuals in their district that they're going to service a fee to gain services. So to receive this funding, they would have to have a list of all of the Creek citizens that reside in their boundaries and be willing to waive those fees if they charge any. Sometimes they don't charge them, but the majority of them do, because that's the only way they raise funds. I believe for Rolling Hills, we did establish though that they're a little bit unique in that they are funded through an ad valorem tax, which is assessed on every holder through a law. So in this case, if they were here, I don't know if they're here, I don't know that they could waive that ad valorem tax on them. So they wouldn't therefore be eligible under Section E, because they can't waive that fee if it was assessed on them. So they're getting that funding no matter what. So that was just something we wanted to provide to HEW and to anyone else. I'm sure our office is happy to put something in writing if needed, but this was just something we researched and found for you in the last 48 hours or so. So if you have any questions, I'm happy to answer them.
Thank you, Ms. Topaz. Yes, would you please send a letter to April, and I will also send a letter to them with your letter attached.
Yes.
Please, on why they weren't eligible. Any other discussion? Roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Hill.
Yes.
We have 1 in favor, 0 against.
1 in favor, 0 against. The Rolling Hills Fire Department is postponed indefinitely. Next item on the agenda will be TR 20-025, a trial resolution of the Muskogee Creek Nation authorizing Principal Chief to execute a project funding agreement between the Muskogee Creek Nation Department of Health and the Choctaw Nation of Oklahoma on behalf of the Muskogee Creek Nation Department of Health. Sponsors, Representative Jennings.
Motion for due pass.
Motion for due pass by Representative Jennings,
Second.
second by Representative Deere. Discussion. Representative Jennings.
Terry?
Thank you, Mr. Jennings. Thank you, Committee Chairman. These next two pieces of legislation is money that the Choctaw Nation of Oklahoma goes out and they apply for this money as a coalition of tribes in Oklahoma. Our portion of this would be $150,000, and that $150,000 will go towards diabetes prevention activities. So it'll be advertisements, doing different kinds of commercials, public awareness campaigns, all preventative type of activities. So that's going to be really the short of it for these next two pieces of legislation. And I'll be happy to answer any questions if you have any.
Questions from Mr. Terry? Ms. Crawford? Roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Hill.
Yes.
We have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda, the NCA 20-006, a law of the Muskogee Creek Nation authorizing expenditure of grant funds awarded for the Choctaw Nation Project Funding Agreement grant to the Muskogee Creek Nation Department of Health. Sponsored Representative Jennings.
Motion for due pass.
Motion for a due pass by Representative Jennings, second by Representative Marshall. Discussion. Representative Jennings.
I'll let my previous comments speak for this one as well.
Thank you, Mr. Terry.
Thank you.
Ms. Crawford, Mr. Marshall, any questions? Roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Hill.
Yes.
Chairman, we have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda will be other business, the Department of Health update, Secretary of Health. Mr. Terry.
Thank you, Chairman, Committee. I'm going to start out with the financial document that you don't have in your packet. This is actually Ms. Crawford's notes that we talked about. In the first quarter of 2020 versus the first quarter of 2019, so I'm comparing October, November, December of 20 to October, November, December of the previous year. Our clinics increased in gross revenue $4.3 million ahead of where we were at last year. So we had a really, really good first quarter in clinic revenue. Our kept appointments in the clinic increased almost 3,000 kept appointments in the quarter, so that's really good. We delivered a lot of care there. And our total expenses this year has increased $1.6 million. So expenses, gross revenue, everything is kind of trending the way you want to see it. Revenue's going up, expenses are going up proportionately, our visits are going up. So I think everything is tracking exactly the way it should. Hospitals increased the first quarter of 20 in gross revenue by $2.3 million. Our admissions stayed virtually the same, but the outpatient surgeries increased by about 80 more surgeries this quarter. The emergency room visits, we've done 800 more ER visits than we did this time last year. Outpatient visits for lab radiology have increased almost 1,000, and the expenses for the hospital has only increased by $200,000. So we have drastically increased revenue, and our expenses has only gone up $200,000. So we're really, really happy about that. So when you get into the report that I put into your packet, we've highlighted some of the things that the public health nursing department has submitted to you guys, really focusing on the immunizations around the state, that they entered 203 patients into the system in January. The Eufaula Public Health Nurse assisted with distributing the community assessment survey information to McIntosh County. As you guys might remember, we passed that legislation last month on what we were doing there. Coweta Public Health has been working with Wagner County Emergency Management System to hold the Safety Expo in Coweta on March 28th. So, March 28th in Coweta. The Sapulpa Public Health Nurse provided education outreach to 50 Beggs High School students at the Watch Your Plan event regarding general overview of all immunizations. So the public health nursing, I'm going to try to each month highlight what they're doing out in your community so you have access to that. So you'll be seeing that. As you guys know, what you've seen on TV and all of the announcements all over the news, that the Center of Disease Control has been closely monitoring this coronavirus, and everybody is really concerned about it. We have been staying up to speed. We sent our infection control person to all of the CDC training and information about the coronavirus. Whenever they got back, we had a meeting with all of the administrators, and all of the clinics are prepared as to what would happen if they have a patient that should walk in. We will be asking all patients that are showing symptoms to wear a mask. If you guys have heard anything controversial or negative over the last couple of days, the very first piece of information that went out from my office said that all patients are wearing a mask, and that wasn't what the intent of the information was supposed to be. It was supposed to be all patients that have symptoms. So that got confused, and we've had to backtrack that out. So if you've heard anything about that, that was purely a misstep on my part, and we apologize for it, but we're correcting that. Strangely enough, those masks that you see people wear inside the clinics or out in the community, it just so happens that all of those masks are made in Wuhan, China. And so right now we are restricted in our purchasing agreement to about 2,500 masks a month right now. So we're looking for solutions that if this thing does turn out to be something that we have to start masking massive amounts of people, that we're trying to start trying to store this stuff the best we can. So that is something that we're aware of. It's going to be something that we're going to have to work through, but we do think that we're on top of this thing from an infection control standpoint. Is there any questions about coronavirus? Does anybody?
I have a question.
Yeah.
Well, if you've watched television,
Yes.
and then I was in New York a couple of weeks ago, and they have a huge Chinatown there, and they were all wearing masks. But at the same time, they were saying that the mask is not as effective
That's right.
as people think they are.
That's right.
So
You have to have a certain level of mask, and those masks go all the way from, you can use it to spray painters wear them inside the houses, to surgical masks that have really high concentration So they're rated at different ratings. Those ones you see just out on the street are effectively doing that.
So what kind are we using?
We use the ones that are rated for the surgical protection, so
So if a patient comes in with similar symptoms, then they would get that kind of
they
thing?
would. Yes. Yeah. Our infection control people they're very, very good. I would say that that's one of the proudest things that I've been one of the biggest things I've been proud of over the last couple of years. We've really stepped up our game in infection prevention, control, and the surveys. We just had a survey from the state leave today at our skilled nursing unit, and basically there were no findings and just 3 very small things. So when the state can come in and review you and leave with basically nothing, that's pretty good. So very, very proud of these guys. I won't belabor over the finances too much more. The total collections, these are December numbers that you're going to have in your packet, not January numbers. The number that we collected in December was 5.1 million. As you guys are aware, Creek Nation is off a lot of days in December, and that hurts my collections. So I don't want this to be an alarm for anybody. Even though it's not reported in this packet, we did bounce back in January. We collected 6.2 million in January, so we were back up over another $1 million last month. And then after that, you'll get into the graphs that I always provide to you. Once again, there's nothing on the graphs and trends that are showing me any concern. I think everything's trending the right way, and I think that the Department of Health has been very solid in its operational and financial metrics. I'll let you guys look at all of the finances by facility back there. Budget-wise, we're very strong. The Indian Health Service did get an additional 5% in funding for 2020. So we think that's going to represent, what we say,
We got 964 this week.
we got $964,000 extra this week from Indian Health Service. So there's a little extra money. Things are good. Our contract health, our new contract health system that we've been trying to really get fully implemented. We're continuing to work all of that process through. We're getting faster and faster and faster every week. So I'm hoping in the next 30, 60, 90 days, we're going to be able to have this contract health thing down to an art form. So we're working through it. It's been very painful for our employees. They have been upset. They've hated me at times. They've called me every name but sunshine at times. But we're working through it. They work very hard. Our contract health staff are very dedicated to our patients and our citizens. And so if you do run into contract health people, please tell them how much you appreciate their work, because they have worked extremely hard to get this new software process implemented. With that, I think that's the bulk of my report, and I'd be happy to answer any questions that you guys may have.
Questions from Mr.
How's it going with trying to get more citizens insured?
So, we are asking the citizenship office for names and addresses of citizens that are over the age of 65. And so we are going to start looking at, the Department of Health is going to pay the Part B premiums for all of our seniors that are over 65, and we're going to pick up the Part B premium insurance. We think that there's about an 8-to-1 return on our money in our investment for us making those investments in the Part B premiums. So that decision for the Citizenship Office to release that information to us is probably going to have to go to the Attorney General's office, I'm sure. So, but I don't think they have a habit of just releasing names and addresses, so that may be sensitive, but we need that information. Because we think that we're also going to be able to pick up the at-large citizens as well. So this will really be the first time that we've been able to provide a healthcare product for at-large citizens. And what we're going to do is try to encourage them to use our mail order pharmacy. And we think that we can make the money back with our mail order pharmacy and at-large citizens for that investment. So we're real excited to be able to provide that service. And we continue to evaluate citizens that we need to put on the Affordable Care Act and pick up that. So that's kind of done every month. We get those citizens that we feel like we need to do that. So I think it's gone pretty well. We have saved a lot of money, and some of those citizens have really gotten insurance for a year, and I think it's been good.
Is it still open enrollment all the time for Native Americans? Because it used to be at one time.
It's always open enrollment. There's a 30-day waiting period. So, but you can enroll anytime throughout the year.
Is that for everybody or just Natives?
Just natives.
Okay.
Thank you, Mr. Reverend Jensen.
So how is the pharmacy at Coweta, how's it going?
So I asked that question on Monday, and the general contractor said that he was hoped to be out of there, I think by Friday. It's either this Friday or next Friday. My facilities director was skeptical that that was going to happen, and he said, well, that's what I've been instructed to do. So as soon as they come out, then McKesson will come back in with their product, and we will get the software and hardware all implemented from McKesson. So I think that we're probably looking maybe by the 1st of April.
Anything else, Reverend Jensen?
Yes.
So you said Part B,
Yes. That's the outpatient. So with Medicare, you have Part A is the inpatient that everybody gets for free, and then Part B you have to pay for, and there's a premium that goes with that Part B. So we want all of our citizens to get that Part B, so that way when they come and do the clinics, then we can collect that money inside the clinics. And so a lot of our citizens, have never felt like they needed to carry Part B because they come to our clinics. And so we want to encourage them to get that Part B, and to do that, we're going to just pick up that cost.
but does Social Security not penalize you if you didn't sign up when you were 65?
They do, and we have made a deal to where we can pay the penalty.
Because I didn't sign up.
I'm aware of that, Mr. G. No, I'm really not. That was a joke. But we do have a process that we can pick. We do have a process that we can pick that penalty up.
Well, I had private insurance, so
Yes.
I didn't feel like I needed it.
I understand. It's a confusing thing, and many citizens that didn't know that they would get the penalty. We're making the argument, my argument to Social Security is that because they have IHS coverage, there shouldn't be a lapse. That right there should be a continuation of benefits. So we're trying to make that argument, but still in the long run, it'll be better for us just to pick up the penalty and move on with it.
The lawsuits with IHS, so
Yes.
we settled one, and
We've settled both.
Both.
We have.
Okay.
So, I think the expectation is we should be getting a check for somewhere around $18 million. I'm hoping in the next 30, 60 days.
Thank you.
Representative Jennings. President Beard.
Okay, so for Part B, do we enroll with you or do we enroll with Medicare? I mean,
Well, you can enroll with Medicare. As soon as we launch the program, we're going to take those citizens that are already paying that, and we're going to, it's going to be a reimbursement cost. We can't pay it up front, so we're going to have to reimburse the citizens for that. So if you're already doing this, we're going to pay for yours as well. So it's not going to be based on some kind of sliding scale or anything. So even if you're paying for B today, we're going to pick that cost up.
thank you.
Representative Beard. President Moore. Any other questions for Mr. Terry?
I have one off-the-wall question. Prevention-wise, has ever been discussion on actually having a separate fitness center besides the dome that would actually be open to use?
We have been in talks with Mr. Agee over at the Dome. And one of the things that the Dome represents is that the priority, and this is not a negative, I'm going to say it's going to sound like a negative, but the Dome is really for basketball tournaments. And every time a basketball tournament happens, the workouts at noon and the workout for our employees stops. And it may go a week. And so the ability for us to get our employees consistently on workout routines is very tough when the priority for the Dome is really for sports. And so we have started to put together a plan to where maybe we can start to get several departments to collaborate together and bring a plan together and build a new fitness center maybe over on that. So I predict in the next couple of months we'll have a plan. I have an architect that I already have on contract, and I'm going to get them to give me just a sketch for that. Mr. Agee and Dwayne Tiger, my diabetes manager, went down to Choctaw to Durant today to look at their facility.
Okay.
And so we have been talking about it. Yes, thank you for that
No
question.
problem. Thank you.
Thank you, Representative Blue. Representative Randall? Representative Hicks? Representative Gary? Thank you very much.
Thank you, Chairman.
Next, Department of Health Finance update, Chief Financial Officer, Ms. Crawford. That was part of his, right? Now, entertain a motion to go into executive session. Representative Beard made a motion to go into executive session. Second by Representative Jennings. All in favor say aye. Aye. All opposed, same sign. We're in executive session at 2:28. Mr. Terry, who would you like to stay? Who would you like to stay? Representative Randolph, any announcements? Representative Henry, any announcements? We will have 3 joint meetings, correct? And those will be prior to planning. So we'll get the email out on those in the next week. Any other announcements from council? Hearing none, entertain a motion to adjourn.
So moved.
Representative Jennings made a motion to adjourn.
Second.
Second by Representative Beard. All in favor say aye. Aye. All opposed, same sign. I'd like to ask Representative Crawford to please give the benediction.
Dear Heavenly Father, thank you for this day. Thank you for allowing us to come together and gain more knowledge for our citizens and hope that we can improve and just go with us as we journey off to our homes. Watch over us